All right. So now we'll move on to our keynote presentation. And every year at the Summer Institute, we have a panel discussion that we sponsor as a PAHO WHO collaborating center. So our speakers today will be Christopher Oura from the University of West Indies and Laura Kahn, the co-founder of the One Health Initiative. The title today is One Health, a Multidisciplinary Approach to Optimal Healthcare for All. Then afterwards, the breakout session that will be interpreted is the one on international procedure skills training and the nurse practitioner role, presented by Ray Blush and Deborah Lee from the University of Michigan School of Nursing. The research and policy breakout session today with Shonda Demarest is Healthcare Without Harm, Climate Resilience in Healthcare Systems. That session will not have live interpretation. The flash presentations on today feature first research from Latin America. These flash presentations will be presented in Spanish with simultaneous interpreting to English. Then we'll have research from Indonesia and research from Uganda featured on the flash presentations. Our next session will begin in just a few minutes. Remember, each session has a unique Zoom link, and please refer to the Summer Institute Eventbrite page to find the link for the sessions you wish to attend. If you have questions, general questions for the organizers, please email us at umsnsummer.institute@umich.edu. All right, I'm going to take a deep breath and we will go on and begin our panel discussion since we started just a few minutes late this morning. So the panel discussion's theme is One Health, a multidisciplinary or transdisciplinary approach to optimal health for all. Each year, the PAHO WHO Collaborating Center presents an opportunity for Summer Institute attendees and for nurses from the PAHO region to hear from experts about a theme related to the Summer Institute and to ask them questions. So this session has a longer Q&A. It is meant to be a dialogue. Please note that the views of the presenters are those of the presenters, not of the World Health Organization or the Pan American Health Organization. This year, the focus of the closing panel is the importance of a One Health approach in our work as healthcare providers, policymakers, and researchers. Many of the challenges discussed yesterday require us to think beyond a narrow focus on human health. I'll begin by sharing a few brief definitions, but I would really like to leave the rest to our panelists as they are truly global experts on this theme. So definitions of One Health have some key central features, regardless of where you get the definition from. So One Health is an integrated, unifying approach that aims to sustainably balance the health of people, animals, and ecosystems. It involves defining and implementing programs, policies, legislation, and research that require multiple sectors to work together to achieve better public health outcomes. I want you to pause if you were here yesterday and think about yesterday's keynote and how much we were discussing the need to involve multiple sectors if we're going to make a difference, for example, in maternal child health. One Health is critical to addressing health threats in our interdependent animal-human environment interface. There is also a clear link to climate change and to disaster preparedness. The One Health approach addresses the collective need to take action. And this would include action on climate change, clean water, energy, and air, and contributing to sustainable development. The Food and Agricultural Organization of the United Nations, the World Organization for Animal Health, the United Nations Environment Program, and the World Health Organization have all committed to taking a One Health approach to environmental challenges and to recognizing their cumulative effects. And you can see very clearly that One Health connects to Sustainable Development Goals. These are only two of the goals that connect. As you listen, you'll see that there are many more of the 17 goals that connect to the One Health approach. Hang on. Who's calling me? All right. So the other thing I want you all to think about as you listen is to think about how the concepts discussed apply to your own practice. If you are a direct healthcare provider, a nurse, a midwife, a physician, how would a One Health approach change the solutions you might consider? How would it change how you see prevention of health problems? How would it change how you see sustainability? And also, importantly, as you listen, think of questions that you would like to ask our speakers. And speaking of our speakers, our first speaker for our panel today will be Dr. Laura Kahn. Dr. Laura Kahn is a physician, author, and educator. For almost 20 years, she was a research scholar with the program on science and global security at the Princeton University School of Public and International Affairs. In 2006, she published Confronting Zoonosis, Linking Human and Veterinary Medicine in the CDC journal Emerging Infectious Disease. And that piece helped launch the One Health Initiative, which is a global effort to promote the One Health concept that human, animal, plant, environmental, and ecosystem health are linked. She's the author of 2 books, Who's in Charge? Leadership During Epidemics, Bioterror Attacks, and Other Public Health Crises. The second edition was published in 2020. And she's the author of One Health and the Politics of Antimicrobial Resistance, published in 2016 by Johns Hopkins University Press. Important for our audience to know, in June of 2020, she launched her Coursera course called Bats, Ducks, and Pandemics, an Introduction to One Health Policy. This course is something you all may be interested in joining. The course has thousands of students enrolled from around the world. In 2014, Dr. Kahn received a presidential award for meritorious service from the American Association of Public Health Physicians, and in 2016, the American Veterinary Epidemiology Society awarded her with their highest honor for her work in One Health, the K.F. Meyer James H. Steele Gold Cane Award. In 2023, she published a One Health themed science fiction novella. So for those of you who, like me, are big science fiction fans, you can look for this. It's a novella for students entitled Thorns, When Earth Refugees Are the Aliens. She is currently finishing her next book on One Health and the coronavirus. Before I switch over to her slides, I'll introduce our second speaker, Dr. Chris Oura. Dr. Chris Oura is a professor in veterinary virology at the School of Veterinary Medicine at the University of West Indies in Trinidad and Tobago. He's a qualified veterinary surgeon, has a PhD in viral immunopathology, and has many years research experience working predominantly on vector-borne viral and protozoal diseases. Chris has worked in many countries around the world, including Mexico, Uganda, and Zimbabwe. He took up the post at the University of West Indies in early 2012 and is currently running a One Health-based research program. From 2014 to 2017, Chris was leading a large European Union-funded project promoting One Health across the Caribbean region called One Health, One Caribbean, One Love. He has recently received the UWI Vice Chancellor Award for Research and is currently a member of the UWI COVID Task Force and is leading a Climate Change and Health Leaders Fellowship program. All right, so with no further ado, we will switch over. A quick reminder to please post your questions as you listen in the Q&A. And also there is our email in case you need to reach those of us who are organizing. All right, so we will switch over to Dr. Kahn. I will, and Janet Gribbins will be running your slides in the background, and I will mute myself.
Thank you, Megan. Well, good morning, good afternoon, and good evening, wherever you might happen to be in the world. I'm delighted to be with you and to be part of this Global Health Summer Institute to talk about One Health. Today, I'm going to talk about a One Health analysis of food safety and security, antimicrobial resistance, and climate change in the 21st century. And yes, they are indeed all interconnected. Next slide, please. Can you hear me, by the way? Is this okay with the headphones?
Yep, nope, it's perfect.
Sound is excellent.
Perfect, thank you. Next slide, please. So I think it's important to recognize that agriculture is the foundation of civilization, and climate change threatens agriculture and food security. And at the same time, antimicrobials are the foundation of modern medicine, and antimicrobial resistance threatens antimicrobial use and food safety. Next slide, please. A few definitions before I continue. Food security means no hunger. Food safety means no foodborne illness. And when I talk about antimicrobial resistance for the purpose of this talk, I'm focusing on bacteria that are resistant to antibiotics. You can certainly have viruses and fungi that are resistant to their relative medications, but for the purposes of this talk, I'm focusing on bacteria. Next slide, please. So the One Health, you've heard a lot about One Health. The concept very simply is that human, animal, plant, environmental, and ecosystem health are linked. And this concept provides a very useful framework for examining the complex issues such as food safety and security, antimicrobial resistance, and climate change that I'm going to be talking about today. We must examine the root causes of these complex health threats if we're to develop effective policies to address them. And I think it's important to recognize that people interact with their environment every day by inhaling air, drinking water, and ingesting the plants and animals that we call food. And I'd just like to highlight the One Health Initiative website that my colleagues and I run. Next slide, please. There's many ways to visualize One Health, but for me, I think of it as a multidimensional matrix or a cube. Along one dimension are the One Health factors, humans and animals, plants and environments and ecosystems. Along the second dimension, you can have complexity factors, microbial, cellular, individual, and population levels, providing scale. Along the third dimension, you can have the political, social, and economic factors, and that can be represented by political borders at the local, regional, national, and international borders levels. A fourth dimension can be time, which I do not have visualized here. Next slide, please. Now, if we squish that cube into two dimensions, you can see how they intersect with each other. And so you can then use this as a framework for examining these subjects. Just a quick note, when I talk about environments, I talk about the abiotic or the soil, water, and air aspects of defined geographic areas. And ecosystems are the biotic interactions, the microbial flora and fauna within defined geographic areas. Next slide, please. So in this talk, then, we're going to do a very quick One Health analysis looking at One Health factors, intersecting with complexity factors, microbes and populations, looking specifically at fecal microbes. And the political, social, and economic factors is at the international or global demand for meat, looking at years. Next slide, please. Or in other words, we're going to do a One Health satellite perspective of the whole world in our analysis in this talk. Next slide, please. So our first One Health analysis, we're looking at humans and domesticated livestock. Next slide. So latest population estimates as of 2023, there are about 8 billion humans on the planet. And according to the Food and Agriculture Organization of the UN, there's about 30 billion terrestrial food animals. Next slide, please. This paper by David Barondis and colleagues and published in 2018 estimated the global recoverable human and animal fecal biomass that all 8 billion humans and 30 billion animals produce. In sum, we produce around 4 trillion kilograms of fecal waste each year, and that amount is increasing. Next slide. To put that into perspective, this amount would fill over 1.6 million Olympic-sized swimming pools, and by 2030, over 1.8 million Olympic-sized swimming pools filled with fecal matter. Or to visualize it another way, to completely bury the entire surface areas of Los Angeles and New York City in 6 feet of fecal matter, and we're producing increasing amounts each year. So we're producing a lot of fecal waste. Next slide. So if we look at just human fecal matter, well, a lot of people, 673 million in fact, still defecate outdoors. Many people don't have access to basic sanitation. Next slide, please. In terms of animal fecal matter, they produce around 80% of that 4 trillion kilograms. There's no sanitation systems for animal manure, and there's really very little that we know of what's going on with all of this animal manure that's in the environment. There was one global assessment of manure management practices, looking at only 34 countries. 30 of them had national policies, but very few actually enforce those policies. So there's a lot of animal fecal matter in the environment, contaminating in the environment. And this isn't just in poor developing countries, but this can be in wealthy developed countries as well. Next slide, please. There's many pathogens in human fecal matter that I've highlighted here. I'm not going to read them off for the sake of time, but 1 gram of fecal matter can contain over 10 million viruses, 1 million bacteria, thousands of cysts, and as well as eggs, packed with pathogens. Next slide, please. There's many pathogens in animal fecal matter that tend to get ignored since there's very few studies examining pathogens in animal feces, and I've highlighted them here. Next slide, please. Now, in 2015, the World Health Organization released a report estimating the global burden of foodborne illness. They found that about 1 in 10 people are sickened by food each year. Children under the age of 5 make up 40% of the cases. And of these agents, the diarrheal agents, around 550 million illnesses, 230,000 deaths, vast majority are due to the pathogens that you find in human and animal fecal matter. So it's a major global health threat, these pathogens in the fecal matter that we produce. Next slide, please. All right, so let's look at our second One Health analysis, looking at environments and ecosystems at the international global level. Next slide, please. Specifically about environments, as I had mentioned earlier, climate change threatens agriculture, but agriculture worsens climate change. Next slide, please. To truly understand what climate change means, we need to quickly look at the temperature of the planet, a global timeline, if you will. And yes, if you look at the Paleozoic era on the far left, the planet at that time was very hot. This was when there was no life on land, but there was life in the seas. As we go across this timeline, you see that the temperature of the planet cools. And during the Pleistocene, that's known as the Ice Age. Inexplicably, right at the beginning of the Holocene, the planet began to warm, as you can see the line increasing up to this baseline called the Holocene baseline, the climactic optimum. It's not a coincidence that civilization, agriculture was developed around 10,000 years ago because the climate allowed it. And as long as the temperature remained on this Goldilocks period of on the temperature, we were able to have agriculture and food security, with the exception of a little ice age, a little blip below the Holocene baseline when there was crop failures, famine, and war because the temperature, the climate didn't allow it. Now we are moving off the Holocene baseline up above 1 degree, and we are starting to see the impact, the change, if you will, in the climate from the Holocene baseline that is disrupting agriculture and food security. And so our goal then is to stay as close to this Holocene baseline as possible so that we can continue agriculture, food security, and civilization. Next slide, please. As it is, the World Bank back in 2010 estimated agricultural yields in 2050 due to climate change effects, assuming current agricultural practices and crop varieties. And they determined that much of the world is going to become too hot and too dry to grow food. And that includes many parts of the United States as well. Next slide, please. As it is, we have a lot of people who are suffering from food insecurity, from hunger during current climate conditions. So we don't want it to get worse. Next slide, please. Just a quick go over in terms of the strength of greenhouse gases. Carbon dioxide is the primary gas that's being emitted from transportation and other sources of pollution. Methane and nitrous oxide are the other two major greenhouse gases that we need to be concerned about. Methane is 28 times more potent than carbon dioxide, and nitrous oxide a whopping 265 times more potent than carbon dioxide at trapping heat in the environment. And unfortunately, agriculture is the major emitter of methane and nitrous oxide. Next slide, please. So in terms of US greenhouse gas emissions, we're emitting around 11% of methane, 7% nitrous oxide. Agriculture in the US, around 11% of the greenhouse gases. Next slide, please. In terms of nitrous oxide emission by source, agricultural soil management is a whopping 73% of nitrous oxide emissions, manure management 4%, wastewater treatment 5%. If we look at methane emissions, enteric fermentation or cow burps, 25% of the methane emissions, manure management 8%. So again, agriculture is a major emitter of methane and nitrous oxide, the two most potent greenhouse gases. Next slide, please. Globally, greenhouse gas emissions from agriculture account for about a quarter of all the greenhouse gases. I'm not going to go into this at length here, but just be aware that there are many elements of the food production system that are contributing to the greenhouse gas emissions and climate change that we need to address. Next slide, please. So our goal is to get the deviation off the Holocene baseline no more than 1.5 degrees or at most 2 degrees. Unfortunately, our current policies, as they're written, is going to get us 2.7 to 3.1 degrees above the Holocene baseline. That's pretty disastrous. We don't have any climate policies. We're getting up to almost 5 degrees, which is just not sustainable for civilization, certainly. I don't know about life. So our goal then is to cut back our greenhouse gas emissions so that we can continue agriculture and civilization. Next slide, please. That now brings me to our third one, health analysis, looking at international global food security. Next slide, please. So food security, agriculture, the foundation of civilization. It's built on 3 pillars: food availability, food access, and food use. Next slide, please. Food security is so important that the UN Sustainable Development Goals list it as number 2, or zero hunger. So it's extremely important. Next slide, please. Now, there are many pros and cons to eating meat. As I said, cow burps contribute 25% of the methane emissions. Meat does provide important nutrients, vitamin B12 and iron. There's evidence we evolved into becoming modern humans because we hunted, cooked, and ate meat. And it's an integral part of many religions and cultures. The downside, of course, is that it increases zoonotic spillover risks, and raising all those domesticated animals contaminates environments, ecosystems, and reduces biodiversity. Next slide, please. Nevertheless, global meat production is increasing to provide the nutrients, the need for protein, the demand for animal protein of 8 billion humans. Next slide, please. And eating meat is the norm almost everywhere, with the exception of India, because they have the most vegetarians in the world. But even there in India, demand for animal proteins is increasing. Next slide, please. It is possible to change national dietary preferences, but it requires cultural and societal change, which is not easy to do. It's hard enough to change one's own behavior, much less an entire society. Some of the reasons that people give, particularly Americans give, for cutting back on meat consumption is their concern for their health, for the environment, and for animal welfare and food safety. Next slide, please. So let's sum up now our One Health analysis findings in this talk. Next slide, please. Human and domesticated animal populations are increasing each year and increasing the amounts of fecal matter. That fecal matter is contaminating the environment, contributing to foodborne illness, jeopardizing food safety, and a lot of this fecal matter is emitting methane and nitrous oxide, which is contributing to greenhouse gases and climate change. Animals are producing 80% of the global fecal matter, but it's generally ignored. This fecal matter contains many pathogens, but only sanitation systems are only designed to process human fecal matter, and there's little oversight of animal manure in many countries. As I had mentioned, manure management and soil agricultural management emit methane and nitrous oxide, the most potent greenhouse gases, worsening climate change. And all of these findings then impact potentially food safety and the practice of medicine, as well as food security and the continuation of agriculture and civilization. Next slide, please. Now, the UN General Assembly met in 2016 to talk about addressing antimicrobial resistance. Unfortunately, there was no mention of manure management and its ecosystem impact at all, which is a major oversight. Next slide, please. In terms of the Paris Climate Agreement, there's been no mention of curtailing agriculture's greenhouse gas emissions. At least there wasn't during the Paris talks. There's growing recognition of this. Next slide, please. But there was no discussion in Glasgow in 2021. Next slide, please. There's still a long ways to go. Now, fortunately, the US passed the Inflation Reduction Act, which does have some impact in reducing greenhouse gas emissions, but we still have a long ways to go to try to get to the Paris climate agreement, getting the goal down to 1.5 or no more than 2 degrees. We still have a long ways to go. Next slide, please. So in sum, then, we must restore our beautiful planet, and the One Health concept recognizes that life is interconnected, and it provides us a framework for moving forward. So what can all of you do? Well, I applaud you all for learning about One Health, help to spread the word, develop interdisciplinary colleagues, organize and be change agents. We all must be part of the solution in ensuring the future of civilization and modern medicine. Next slide, please. If you want to learn more, you've heard briefly about my Coursera course, Bats, Ducks, and Pandemics, an introduction to One Health policy. It is free, and I believe the link has been shared in the chat. Next slide, please. And if you like to learn through science fiction, I recently published this One Health themed novella. You can check that out too. Next slide, please. I'd like to acknowledge my colleagues of the One Health Initiative team. And next slide, please. And I'd like to thank you all for your time and attention. And that concludes my talk. Thank you.
Thank you so much, Dr. Kahn. That was great. You're already getting some questions in the chat and in the Q&A. But to make sure that we give Dr. Oura his time as well and give you a break from speaking, we'll go ahead and do the questions at the end. So we'll go ahead and switch over to our next speaker. And I think after we've had this big overview, thinking about One Health and then thinking about specific regional examples will really help the audience and us really understand how we can apply this perspective. So Dr. Oura, you now have the floor.
Hello, everybody. I hope you can hear me. Can I just check that you can hear me okay before I start? Great.
Audio.
Well, it's a real pleasure to be here today. Thank you very much for inviting me. And I'm going to talk to you today a little bit about One Health in the context of the Caribbean, where I live. I'm going to talk about briefly, because we've heard quite a bit already about what One Health is, a little bit about the why we should practice One Health and why One Health is so relevant to today's health challenges. And then I'm going to talk a little bit about what we're doing to promote One Health, to promote these change agents that Laura was just talking about across the Caribbean region. So some of you have been following the One Health program over the past few years might be a little bit confused because there's a lot of different concepts out there. There's ecosystem health, there's global health, there's planetary health, there's One Health. But to me, they're really all a very similar thing. They're finding solutions to difficult cross-sectoral problems affecting humans, animals, and agricultural and environmental health through a transdisciplinary collaborative approach. And we all know when we want to change things, the time has to be right. And as I think Laura said, or maybe it was Megan, the time is right now for One Health. Everybody's talking about One Health. And the international organizations like FAO and OIE and WHO and the environmental organizations are very much promoting a One Health approach. And recently, this particular definition was brought out, which really brought into the environmental players' UNEP, because they were sort of a bit out on the side. And I think it's a very nice definition. I won't go on to talk about it in too much detail because we've heard similar definitions of One Health. But it really emphasizes that it's an integrated, unifying approach that aims to sustainably balance and optimize the health of people's, animals, and environment. And also, critical, it mobilizes multiple sectors, disciplines, and communities. This is a collaborative approach. And when I think about One Health, I think about one sentence, really. It's the importance of working together across disciplines. And really, we need to think about who needs to be around the table to solve the problem, because people are stuck in their silos. They're working on things individually. We need to get out of those silos, break down those barriers, and work together to solve these really complex, wicked, multidisciplinary problems that demand this kind of approach. So when I say who needs to be around the table, what I mean is, and it doesn't matter, and I'll just get my laser point, it doesn't matter what you put in here. One of those big health issues like climate change, we've heard about antimicrobial resistance that Laura talked about, whether it's COVID-19 or Zika or chikungunya. We need to think what expertise, what input do we need to solve or help us address that problem. And inside these bubbles here, there may be different people, different actors, depending on the health issue here, but we need to think about that carefully. Human input, and I see nurses critically, doctors, dentists, pharmacists. We talked yesterday with them about communities and teachers and the importance of the general public. We need academic input. We need to understand the problem and research things that we don't understand. If it's a vector-borne disease, for example, we need entomological input, epidemiological input. We always need to think with any of these big health issues that we're facing about what are the environmental determinants of health. What are the environmental determinants that are going to be affecting that health problem? And the impact of climate change or land use is often critical. And one really importantly as well is the social and the economic input. Understanding the social determinants of this of health for this particular issue, and the economic determinants of health, because we need to develop a social and an economic case for sustainable investment. Because it's this, saving lives and saving money, that pricks up the ears of our policymakers, our ministers, because they're the ones that actually have their fingers on the funds. And they're the ones that are actually going to provide funds in order for us to be able to develop these action plans. The involvement of international organizations is also critically important, as is the private sector, especially when we're dealing with things like antimicrobial resistance or vector-borne diseases that might require vaccines or antibiotic or drug development. We need the private sector to be involved. And also animal input from the animal side, so critical, because many of these health issues that we're facing have an animal, domestic or wildlife angle, needing the input of vets, animal technicians, farmers, livestock industries. And once we get this right, we get these expertise, these people involved that are right, we can really far more efficiently address the particular health issue that we're facing. And those health issues are big, they're complex, and they're wicked, as we call them now. We heard a few of them earlier. Laura was talking about food and water security and safety, feeding and watering the increasing population in the context of climate change, which is going to be challenging so much agriculture, as we heard from Laura. Challenging our foundation to medicine, our antibiotics, as Laura mentioned as well. We need to include a multidisciplinary approach, because antibiotic resistance doesn't only start in humans, it actually starts often in animals, and those antimicrobial resistance genes are passed through the environment. So we need all these angles to be put together. And there is an urgency, as we've seen with COVID-19 and the influx of zoonotic diseases that transmit from animals to humans. There is an urgency to act now. So moving on to the Caribbean, where I live in this beautiful island here of Trinidad and Tobago. And you see that the ring of islands here. Now, One Health is really relevant to the Caribbean because we have so many similar issues to address. We're small island states, but we lack expertise and we lack money. So there is a real need to share that expertise and money. And when we see these hurricanes lining up, as we've seen in recent years, these stronger, more devastating hurricanes than we've ever seen before, affecting our tourist industry, because so many Caribbean countries are reliant on tourism. Also, climate change affecting our ocean health through coral bleaching. We see the need to all work together to address these big health problems that we're facing. So what are we trying to do? We're trying to promote and entrench a One Health approach to solve these big issues that I've just been talking about. And as we mentioned for the people that here yesterday, this is not easy. This is changing the way people think about health issue. And change is never easy. People are very reluctant to make change. And we can make change from the top down or the bottom up. And both are very important. Some are more easier than others. From a point of view of top down, we need to persuade our ministers of the importance of this interdisciplinary One Health approach. And we need to produce policies that actually enable us to enact this One Health policy, to change the way we govern, to get out of those silos, to work intersectorally. Not easy. And from the bottom up, we need to work with communities to develop One Health projects across the interface between human, animals, and environmental health, and hope this trickles up. But how do we do this? It's very difficult because there's a big gap in the middle. And what we need is leaders. We need change agents. We need champions who really understand the importance of the One Health approach and are able to have the ear of our ministers, our permanent secretaries, and also work with communities. And that's what we've been doing in the Caribbean. We've been developing climate change and One Health professionals, change agents, because we've identified this important gap where as I think was said by the first speaker yesterday, we have many reports, we have many policies that are produced sometimes by people outside the region, which are produced and then they're not read and they're just put on a shelf and they're not actioned. We need to identify professionals who can action those policies, who have the skills and the knowledge to be able to action those policies. These are people working within the ministries, within NGOs, within academia, who really are in a position to affect change. And those are the people we've targeted, and we're building networks of these professionals who can support each other in the process of making these changes across the Caribbean. So it's all about enabling and empowering professionals from multiple sectors and countries across the Caribbean to lead and implement change in One Health and in climate change and health. So let me just, what I'm going to talk to you today is about a couple of programs that we've been doing over the past 10 years to develop these networks of professionals. The first you see on the left is One Health, One Caribbean, One Love project, where we've been developing multidisciplinary professionals across 12 Caribbean countries. And the second is a climate change and health leadership fellowship program, which we're in the process of implementing now. And we're learning as we move forward. We're constantly learning of how we can do a better job with these programs. How do we maximize the learning opportunities? Because in both these programs, we're dealing with experienced, knowledgeable, but extremely busy and stressed adult learners with very little time. These are people right at the coalface working within ministries, in the Ministry of Health, the Ministry of Environment, the Ministry of Planning, NGO sectors. So we need to make the learning fun, but also useful. And we need to enable these professionals to build relationships and friendships, because we all know that's how work is done. So we run an adaptively managed program, which is modified based on what the fellows bring to the program and need from the program. And this will be different each year because we have a different group of fellows every year. And critically, as we run this fellowship, we have the fellowship is run. We have I'll just go back one. We have, as the fellowship is run, sorry, we have online sessions every week where we bring in local and regional experts. So experiences are really grounded in local realities, and this is really important. And we need to tie the learning to tangible real world issues relevant to the learners. We also, the fellows carry out real world national projects within their home countries. So there's very much a learning by doing approach. So we maximize the opportunities for practicing what they've learned. We maximize the opportunities for peer-to-peer learning, and we maximize the opportunities for learning through shared experiences. So these are the fellows here, the climate change leaders here from 12 different Caribbean countries. We run sessions over a couple of years where we had different combinations of themes to different workshops over the years. And as I said just now, throughout between those modules, they carried out a national project at the interface between humans, animals, and environmental health. This was very much a bottom-up approach working with communities. And you'll get these slides, so you'll be able to see some of the really exciting projects within communities, One Health-focused projects that these One Health leaders carried out. And I don't have very much time today, but I just wanted to talk very briefly about a couple. This was in St. Lucia, where the Solution One Health leaders killed 3 birds with 1 stone. So they introduced gardening in schools and communities. So they addressed childhood obesity through growing of a nutritious, healthy products. And where did they grow those products? In solid waste cartons, in tires, or you have to be a little bit careful about toxicity here. And what actually breeds in those tires, in those containers? Yes, Aedes mosquitoes that produce very severe mosquito-borne diseases. So not only are they solving problems with childhood obesity by working with the communities, but they're also educating the communities on the importance of solid waste management and mosquito breeding sites in the process. Dominica, working with the communities to solve a really important health issue, iron deficiency anemia, growing iron-rich vegetables with the kids and with the communities, and not only growing them, but also bringing in very nice recipes and ways of cooking these iron-rich products. In Suriname, where there's a real problem with heavy metal poisoning running into the rivers and going into the fish and causing very severe heavy metal poisoning in some cases in the communities that live downriver, our One Health leaders were bringing in hydroponics, so bringing in to those communities downriver opportunities to produce fish and vegetables safely without the heavy metals. And finally, in Trinidad and Tobago, looking at the real problem with accumulation of heavy metals in shark, an apex predator, which is a very common and a very popular form of food in Trinidad. So you can see from those few projects the links between environment, humans, animals, and how from the community bottom up, the leaders are really showing One Health in action across the region. And just for the last couple of minutes, I wanted to talk about the Climate Change and Health Fellowship Program, where again, we're using a One Health approach to train professionals. And this is a 12-month blended learning curriculum directed program, which has workshops either side, and then, as I said earlier, this weekly themed online sessions throughout, where the fellows get together every week for a 1.5 hour session where we discuss really pithy issues around One Health, really training them to be agents of change in the region. They also, through this learning by doing approach, have the opportunity to implement a nationally relevant project like the previous project, and also carry out a workshop and symposium to develop networks in their home countries. They also spend a week in the Climate Change and Health regional agencies. So we have the first group of fellows from 6 different countries: Haiti, Barbados, Bahamas, St. Vincent, St. Lucia, Suriname, multidisciplinary people working from the Ministry of Health, Ministry of Environment, NGO sector, all experienced professionals, all carrying out a project like we said before. And I don't have time to talk about these projects, but they're all working on a climate change and health focused project using a One Health approach in their home countries. And this is the second group of ladies, all ladies in this particular fellowship, in this particular cohort, from Jamaica, from Trinidad and Tobago, from Guyana, from Grenada. Again, multiple disciplines that come from a monitoring evaluation officer, a disaster management specialist, chief public health officer, a program manager from the Peace Corps, a regulatory economist. So these fellows all as a group are extremely strong as a fellowship program, much more strong than the individual, because they all support and help each other going forward as a family of fellows. These cohort 2 fellows are finishing next week. In fact, I'm going to Jamaica next week for the summative workshop. And as you can see, they've developed really exciting projects, such as addressing gender-based violence in times of disasters, developing a climate change and health policy in Trinidad, readiness assessments for farmers in Jamaica in relation to weather. So lots of really exciting projects. This is One Health actually working across the region. So I hope I've given you a flavor of One Health in action and how you can develop these kind of projects from the bottom up. Yes, we need to work from the top as well. We need to work on our ministers. We need to change governance. We need to get out of our silos. but we also need to work from communities, and how you can work from these communities. People see how more efficient and effective this approach is, and that really pushes the whole program forward. If you'd like to learn a little bit more about some of the work we've been doing on One Health in the Caribbean, you can see on the left here this book, Caribbean Resilience and Prosperity Through One Health, which is freely downloadable here, where you can read about some of the work we've been doing across the Caribbean. And I'd just like to now leave it to Megan, who is going to show you a little video produced by I'll stop sharing, produced by our celebrity patron, Basie, from Jamaica, which explains a little bit about some of our One Health leaders and what they're doing. And when this is showing, this is only 3 minutes, you'll have time to think about questions that you can ask us. It's been a pleasure talking to you today. Thank you very much.
Thank you so much, Chris. And as the video plays, please continuing to add questions. Thank you, Laura, for answering some of the questions in writing. I'll probably re-ask them, a few of them, so people can hear the answer. But as the audience continues to fill the Q&A, we will listen and learn.
Basie, Kahn. Yeah. Listen me. Listen me, feature. Spread the one that's with the paper across the region. Listen me, feature. Listen me. Listen me, news would like to introduce you to this brand new concept. One health, one Caribbean, one love. One health, one Caribbean, one love. Together we're strong. One health, one Caribbean, one love. Together we're strong. One health are the brand new concept to fight virus and diseases. Calling all of the various doctors, let's work together to achieve this. Human doctor, animal doctor, the environmental doctor. Each one an important factor. The public health have a brand new chapter. A good example of chickpea. Even if it don't hurt you, then it still hurt me. If you check the process, you will see it move from the environment to animal, then to we. First from the egg in the water, then from the water to the mosquito, then from the mosquito it goes straight to the people. But if we work together, then it leads to one health, one Caribbean, one love. Together we're strong. One health, one Caribbean, one love. Together we're strong. One health is not just for people with medical occupation. It is for the entire population. So we need everyone cooperation across the region. Improve food security, better solid waste management and water purity. Protect the habitat for you and me, for the animals on the land and the fish in the sea. One Caribbean, one love. Together we're strong. One health, one Caribbean, one love. Together we're strong. Enough respect to one health leaders. 12 countries across the region. To a help the Caribbean, them a leaders. Let me list out the island: Jamaica, Grenada, Guyana, Belize, St. Lucia, St. Vincent and the Grenadines, Suriname, Barbados, Dominica, Trinidad, Tobago, Haiti, Antigua. One health, one Caribbean, one love. Together we're strong. One health, one Caribbean, one love. Together we're strong. One health, one Caribbean, one love. Together we're strong. One health, one Caribbean, one love. Together we're strong.
All right. Thank you, Chris. That was great. And as hoped, the questions were popping on in. So I will go ahead and get us started by actually re-asking a question that Laura was kind enough to answer online, because I think it captured a number of the questions that have been coming in. So this question is from Raymond Oteam. Thank you for the presentation. It was very beautiful. You talked about fecal matter, especially animal matter, as contaminating the environment. How is this the case, especially on methane gas and climate change? And then what can be done about it, considering animals on free-range systems in low and middle-income countries? I felt like this question got at some of the how does this apply in lower resource settings, as well as put together some of the other questions well.
Yeah, it's a really good question. Well, a lot of countries don't have sanitation systems for humans, and certainly not for the animals, and they're defecating in the environment. And as I had mentioned in my talk, animal manure contains a lot of pathogens that contribute to foodborne and waterborne illness. So if they're contaminating the environment, they're going to leach into the soil, into the water, the crops pick it up, and you get foodborne illness. Now, in terms of climate change, manure does release greenhouse gases. But interestingly, I didn't get time to talk about the Green Revolution that occurred in the 1960s. And that's another whole subject in and of itself. But what I will say is that the Green Revolution, one of the requirements for it, and that was the development of these novel crops, these genetically modified crops that increase the yields of different grains such as rice and wheat. But they required intensive fertilization to do it and watering. And so because of the Green Revolution, manure is being used less as fertilizer and being replaced by high nitrogen synthetic fertilizer. The problem with high nitrogen synthetic fertilizer is it releases whopping amounts of nitrous oxide into the environment when it's used for agricultural soil management, which is why you saw it contributing over 70% of the nitrous oxide. So at the same time, a lot of soils around the world are being depleted from their nutrients. So manure provides important nutrients for the soil, provided that it is composted or processed to remove the harmful pathogens that cause greenhouse gases. So in an ideal world, we would use a lot of this composted animal manure as fertilizer, low nitrogen synthetic fertilizers to supplement as needed, low till or no-till agriculture, as well as the use of cover crops and drip agriculture, drip irrigation. So there's a lot of strategies that can be used to diminish agriculture's greenhouse gas emissions. Manure can play an important role in restoring the health of the soils, provided that it's processed or composted to remove the harmful pathogens. Great,
thank you. And I think that answers a few of the other questions that were along a similar line in the chat. We have a comment and question from Amelia for Professor Oura. So thank you for an interesting and informative presentation. Is the Climate Leadership Fellowship Program open to internationals? And thank you for sharing about the program. So is it open to internationals? And if not, how would you suggest that other regions get started on a similar project?
Thank you for the great question. I'm afraid at the moment that our Climate Change and Health Fellowship is only open to 16 Caribbean countries because it's part of a European Union funded project, which is building climate resilient health systems within the Caribbean. However, we are looking at opportunities to open it up to other people from other countries when the project finishes, which will be in 2025. I mean, I think the model that we've used, it works. I think it's really making a difference. So please, anybody who feels that they would like to follow the same kind of model, please feel free to get hold of me. I try to promote it as much as possible, as I'm doing now, and I'm off to Uganda in a few weeks' time, and I've been talking about the program. So yeah, I mean, I think I think, as I said, the critical thing here that we're trying to do is target professionals working within, working at the coalface, who are actually in a position to affect change. So we're not looking so much at undergraduates or postgraduates. Very important that they get this kind of education or this kind of training, yes, but we're really trying to target people who can make a difference now, because, as we all know, now we need to change the way we do things, improve the efficiency of the way we do things, and we have the opportunity to target the kind of people within the kind of ministries, within the kind of positions that really can hopefully make the change as soon as possible. And that's why we have this particular target. The problem is, these kind of people, they may not be the sort of natural people who would want to do this kind of program because they're so busy. So we have to really produce a program, produce a curriculum that attracts them, but also it has to be the right time in the evening, and it has to give them exactly what they want. Otherwise, they don't come back for more. So it's really important to make it a unique, bespoke program for this type of person.
Great, thank you, Chris. That was a great answer, and yeah, you're so correct. It is so hard to reach the people who are currently in the positions locally to make change, yet that is who is there now. And we think about the future and our students, but we also have to think about the present, given the urgency. And hang on, I had a question that I was looking at that just disappeared on me. Let's see. Let me see if I can get it back. All right. Well, while I'm trying to find the one that disappeared, I will ask one of my own, and then I'll keep looking for it. So what would you say to members of our audience who are nurses and midwives and other frontline healthcare providers about how would a One Health approach impact how we do our daily jobs or how we approach providing healthcare?
Shall I kick off, Laura? And just, is that okay if I kick off and then you can join?
Please go ahead.
Yeah.
Go ahead.
I mean, I think it's really, we've talked about, One Health in action, but I think it's really important that we instill a One Health thinking in people as well, so people think in a One Health way. And it started off, I suppose, hundreds of years ago with Hippocrates, who said it's better to know what sort of person has a disease than what sort of disease a person has. And when I was first talking about One Health at the University of the West Indies, a doctor came up to me after my presentation and said, I had a really bad experience when a young boy came to my clinic a few months ago. It was in July in Trinidad, where it's very, very wet. And he had symptoms of which was very similar to dengue fever. So there's not, as all you guys will know, there's not much you can do about dengue fever, but you have to be very vigilant about it, because it can become very serious in some cases. So he sent the boy back to his place where he lived, which is in the east of Trinidad, in quite a poor area in the east of Trinidad. And the boy then went off to another doctor, and the doctor did the same thing and sent him back. And then this boy, this young lad, 16 years old, he died. And when they were doing the history, when they were finding out what actually happened to him, they went to where he lived, And it was a very poor area. There was a lot of solid waste, which we've heard about. It was a very wet time of year. There was a lot of water about. And this boy had been going out in the day with his friends, barefooted. He'd be going into the puddles, into the streams. And guess what he died of? Many of you will know what he actually died of. It was leptospirosis. It wasn't dengue fever after all. And my point is, if those doctors, those nurses, whatever, who dealt with him had actually gone to where he lived and they'd taken a One Health history, they would have realized that there were lots of rodents about in the area, a lot of solid waste. He was going out, the most at risk group of people for leptospirosis is young boys who go out playing in the water. So my message to the nurses, to you nurses out there, is think One Health all the time. Think about what the environmental the environmental angles, the human angles, the animal angles, when somebody comes in, and take a One Health history as you move forward, because then only then do you get the full picture. You don't get this unidimensional, this one-dimensional, oh, there's mosquitoes about, it's dengue fever. You see all the other angles, and I think that's really, really critical going forward for medical professionals. Thank you.
Great. Thank you.
Great response. Let me just jump in. I began my career as a nurse, and one of the things that I enjoyed best about nursing was community health and actually going out into the community and educating the people in the community about health issues. Now, we focus just on humans, but as Chris just mentioned, it's really important to get the big picture and to look at the entire environment in which these people live, whether there's roads, whether there's animals living about that are urinating and defecating, the type of food, whether they've got access to sanitation. All of these things come into play in terms of health. And nurses have a key role in that because they will have the ability to, particularly in community health nursing, to go out into the community. The doctors might not have the time, but the nurses, certainly if they're employed by the public health department, to go out and evaluate the people's living environment, whether there's, sites of mosquito breeding or, wildlife defecation or animal defecation. All of that comes into play in impacting health. So nurses play an absolutely critical role in the implementation of One Health. I can't stress that enough.
Great. Thank you. Great answers from both of you. It looks like it looked a minute ago like one of our participants, Olun Funmilayo Banjo, had a hand raised. If you would like to unmute and ask your question live, you could do that.
Thank you. Can you hear me, please?
Yes, we can hear you clearly.
Okay, good afternoon from Nigeria. And I know it's still morning there. I want to ask, what about the use of the animal fecal wastes as manures? I know Laura talked briefly about it. So how are you saying that we should do away with it? Or what? I need more enlightenment on that. Thank you.
Yeah, thank you. It's a really great question. There's a lot. Look, 80% of the 4 trillion kilograms of fecal waste is animal waste. What do we do with it all? And surprisingly, little is actually used as fertilizer because a lot of the farmers rely on synthetic high nitrogen fertilizer. Well, I think, people, particularly, the animals around people's homes, they just kind of get ignored in all the defecation. People might be cleaning up after the animals. Maybe they're not washing their hands. And one interesting thing that I learned from somebody in Rwanda is soap is not necessarily available. So if you don't have access to soap and clean water to wash your hands after you're handling the animal fecal waste, then you are setting yourself up for, getting sick from all the pathogens that are in the animal waste. So ideally, you want to compost the fecal matter or process it in some way. Usually it's heat, but there might be other processes. I'm not an expert in animal fecal composting, but it can be used to replenish soils, agricultural soils, to provide the necessary organic components to help the soils remain rich, to provide the nutrients needed for crops. I've heard that throughout the world, a lot of the soil's becoming severely depleted and jeopardizing future agricultural use. And that's because there's been an over-reliance of synthetic high nitrogen fertilizers and less on the animal manure. But this animal manure comes, it's a double-edged sword. You need it for the organic material. You don't want the pathogens, and you don't want the greenhouse gases that are being emitted from it. So we have to figure out how to best handle the manure. And I don't have the best answer for it other than composting and using it as a form of replenishing soil health. But it's important for the public to know that if you are handling animal manure, just as handling human manure, human waste, you need to wash your hands well with soap and water, soap and clean water, in order to protect yourself from getting sick. And I don't think that message is being shared enough. And I wasn't aware that a lot of countries don't even have access to soap. So that's a business opportunity for people to go into soap making and teaching community members how to, and the kids certainly, how to properly wash their hands.
Thank you for the clarification on that one. I'm going to read one that actually came in the chat, and then I'll pull one more that's a bit different from our Q&A. So Harriet asks, how do we support communities living in harsh environments, for example, droughts and floods, to ensure they have food security and a safe environment, especially for vulnerable groups like mothers and children in low-income countries? And I would actually add from our discussion in one of the breakouts yesterday, also the elderly.
Right. That's a really great question, a really hard question to answer, because, these harsh environments with droughts and floods are only going to get worse as the temperature deviates from the Holocene baseline. We're going to be seeing more extremes, more drought, more flood. That's going to make agriculture and food security much harder to achieve. And my fear, and one of the subjects that I write about in my novel, is, are we going to have to start growing food indoors? Is the climate going to become so unpredictable, so unstable? Are we going to have to start growing crops indoors? And of course, that comes with a whole other host of challenges, including, how do you provide them with sunlight? And you have to provide them with clean water. And either it's hydroponics or it's soil. So, these are big societal issues that we're going to have to start facing if we want to provide food security for people in regions where they're already food insecure for a variety of reasons. So those are political questions that are going to require political answers.
So Chris, I'm curious about your perspective on that question as well, given that you actually live in a region where flooding, hurricanes are a reality now, not a future.
I think one of the critical things here is, and what we don't fully understand, is we need to understand where the vulnerable populations are, who are the vulnerable populations, and what are their vulnerabilities as well. And I know there's a lot of work being done on national adaptation plans, especially related to climate change and vulnerability and adaptation plans, but and I think they're really critical, and because we haven't got an unlimited amount of funds or expertise, so we really need to target our interventions. on vulnerable populations. I mean, we see in Trinidad, for example, we are at the forefront of climate change, and we're seeing highly vulnerable populations living in floodplains. That every year they're being flooded out, and really it's not viable to live in those areas anymore. So we're seeing, after every year, we're seeing increases in food and waterborne diseases like leptospirosis. So really critically, I think it's so important to map and identify where those populations are, so we can target our resources to those people. You have to understand where the problem is before you can actually carry out any or produce any solutions to it. And that's right at the start. It's like with animal diseases, with human diseases. In many developing countries, we don't know what's there. We don't know the background to start with. And it's very difficult, if you don't know the background to start with, to do anything about it. It's baseline data almost. And with vulnerable populations, it's absolutely critical, I think, to know who they are, where they are, what their vulnerabilities are, and only then can we target those populations and try to do something about it.
Great, thank you. And thank you for both answers, since they took different directions on it. That was great. I'm going to try as a final question to combine two, I guess, or I'll read them both and you can decide which one to take, and maybe we'll hear from each of you on this. So Beste asked, what are your thoughts on state sovereignty and One Health related collaborative and universal policies? And Princess asked, how can government officials and researchers make a One Health approach work? So sort of either level, government officials at the national level, or how do we think about state sovereignty and issues that cross borders so clearly?
Right. Well, as I had mentioned, with looking at the One Health matrix, One Health can be the social, political, economic aspects of One Health can be represented at the political border level, at the local, regional, state, national, and international levels. And at all those levels, there are political leaders, policymakers who make decisions as to what to fund and what to support. And if they don't know about One Health, they're not going to fund it or support it. So it's up to all of us to play a key role in educating our policymakers, helping them draft legislation to implement One Health, to provide funding to support these interdisciplinary programs that are so important going forward. I mean, Chris has shown us really, his programs are really brilliant in helping to implement, these important concepts. So it can be done, but it takes concerted effort. And as I said, all of us play an important role in education and advocacy of the public and of the policymakers that are making the decisions on, what to fund. So we all have a role to play. And we need to get out there and spread the word and work to get the concept implemented.
Great. Chris.
Great. Yeah, I know, absolutely agree with what Laura was saying. I mean, that we need to get across that One Health is a more effective and efficient approach, and it saves money and lives. And we can talk about it. And we do talk about it, and everybody agrees, collaborative approach, interdisciplinary, it makes sense. But what we're now actually doing, and so much more, is we're actually producing evidence. We need to have evidence. We talked yesterday about the health economists, the people who actually produce the numbers. We need to be able to persuade our policymakers, our ministers, our prime ministers, that actually this is a more effective and efficient approach, so they're going to save money and lives. And only then will they think about changing the way they govern. And I know this is a big thing and it's very, very difficult to do, but you could imagine a situation where there's a kind of a level of sort of, I wouldn't say, it's like a One Health ministry just within the office of the Prime Minister. And then there are representatives in each of the ministries who report both ways. So they're actually making sure that people are getting out of their silos and thinking across the ministries, and they're working across the ministries. They're talking to the right people. That One Health ministry could just be a table, it could just be a table where every month they bring people from the Ministry of Approach. That thing I showed you, the people from those particular blocks: the Ministry of Health, Ministry of Planning, Ministry of Environment, Ministry of Finance. So they're actually make sure they are working together. To me, it seems quite simple and straightforward that would be a good way of de-siloing government. But as Laura said, these aren't easy. It's very difficult to get people to change the way they govern. But slowly, we need to push our ministers and our governance structures so they change, getting the message out there. And often getting the message coming up from the communities is the way to do it, because they're the voters. If you show it in a small way that it's working within a community, that kind of approach, and the minister goes down there and people are enthusiastic and talk about it, then him or somebody working for the minister, you get that sort of movement happens. It's going to happen slowly, but it makes sense. It's going to happen, and we need it to happen as soon as possible. And we need to all work together, or everybody at this conference. We all need to work together to make change as fast as possible, so we improve the governance of these kind of and how we respond to these kind of horrible health issues that we're facing at the moment.
Great. Thank you both so much. I believe, and my colleagues can unmute and tell me if I'm wrong, but I believe we are at time. Folks who posted questions in the Q&A, the ones we didn't get to, have written answers. I would like to once again thank both of you for sharing your expertise and your passion with us. And I would like to thank the participants for great questions. You've had some thank yous in the chat. A reminder for everyone, if you go to the Eventbrite page, you'll see the links for the next sessions. And only one of the two will be interpreted into Spanish, and it is the skills session. If either of you are willing to have participants email you, a couple people asked for contact information. And although it may be in some of the Summer Institute materials, if you want to drop it in the chat, my guess is people will quickly, the few people who wanted to email you can grab it out of the chat. So thank you very, very much. Folks, their emails are going into the chat, and I will leave the session open for just a moment here, and then I'll close it off.
A pleasure. Thank you for inviting me. I really enjoyed it.
Thank you. It was wonderful. Thank you both.
Thanks very much, everybody.